Welcome to Adapt NCLEX, and thank you for deciding to watch this video. This is really a nice video for you to watch. It talks about OSA, obstructive sleep apnea. In order not to give you too much lectures, I've used questions as a case form in addition to standalone questions to give you the fact, and that one you'll be able to understand it much better. So this is the case. All I want you to look for is the buzzwords. That's all. I don't want you to answer anything. Just look for buzzwords, right? A 55-year-old male. This is a buzzword for OSA. Present to the primary care clinic with the complaint of what? Excessive fatigue, number 2. At work, okay? And irritability. This is secondary to something. Client report of morning headache, another buzzword, even though it does not drink coffee, right? It doesn't drink coffee, so it's not like a withdrawal from coffee. The spouse had to sleep in another room. That's a buzzword due to what? Loud snoring. He sleeps for about 9 hours, but had to wake up multiple times during the night because the spouse said he stops breathing, that is apnea. Client report of 2 moving violation for causing traffic at night. What does that tell you? Daytime sleeping. It's driving and then at the traffic light fall asleep. So you get 2 moving that violation. So I'll put a 2 moving violation for stopping light. He has been going to the gym of late due to his weight. His BMI is too high. Obesity. He came in today because of numerous warnings for sleeping at work. He has history of hypertension and obesity. This is OSA. I've underlined all the buzzwords for you. He denied tobacco and alcohol, which can be a risk factor, but he doesn't take them. So this is what you do when you read a question. You see, as I go, I figure out the buzzwords. I know we already know what it is, but I'm trying to show you how you underline. So, oh, okay. And based on what I've underlined, I can rewrite my question. If you watch my test taking strategy, those are my buzzwords. I know what I'm being asked to do with these buzzwords. I know the case. I've underlined what the individual buzzwords, and I can rewrite the case. I have a 55-year-old, fatigue, irritability, morning weakness, snoring at home, multiple times waking up at night, snoring and stop breathing, apnea, moving violation because of daytime sleeping. He's overweight, he has hypertension, and he's sleeping at work. I've summarized everything. These are your buzzwords, and that is the way they will put it in the case form. And I want you to figure it out. Figure it out. So what are your buzzwords? It's those that I've underlined. Okay? Okay, let's move on. So what is your diagnosis? Narcolepsy is not what was presented. What is narcolepsy? This is the way they will test, give you the question. Okay, narcolepsy is somebody who is sitting there and then fall asleep right away. They just fall asleep like I don't know. They will just fall asleep right away without anything. They'll be standing there and they'll fall asleep. But they don't have those daytime sleeping. They don't have morning headache. They are not overweight. They don't have concentration problem. They don't have all those irritability signs and symptoms. So it's not periodic limb movement. These are people when they sleep, they flex and extend their leg. They flex, extending back and forth. Yeah. This is REM sleep behavior. These are people who start acting out. Whatever they're dreaming, they're acting out their dreaming episodes. So whatever they're dreaming, they will showing it when they sleep. So it's not that. This is an obstructive sleep apnea. Okay? Straightforward. You know it already. I already give you the answer. We know what the period. But what is the diagnosis? What is OSA at all? How would we say somebody have OSA? There is a specific criteria you're supposed to show. You have to have, you stop breathing for at least 10 seconds, right? And when you sleeping throughout the night, okay, there should be decrease airflow, and that is what we call hypopnea. There's decreased airflow through your airway. It should not be greater than 50%, so it should be less than 50%. If it's greater than 56%, you're completely obstructed, you're dead. So you stop breathing and when you stop breathing, it will last for 10 seconds, more than 10 seconds. And most of these when you're stopping breathing, it should be less than 50% of your breathing, not like more than that. So which one is that? Yeah, this is consistent with greater than 10 seconds, right? And this should be selected by, I guess, apnea, 50%, right? Apnea should be more than 10%, and apnea should be less than 50%. So A and B are classic diagnosis of sleep apnea. So apnea episode greater than 10 seconds, and hypopnea and less than 50%. Okay, so those are the two answer choice you should worry about. Okay, what is the next question? 2, 3. So what is the number 4? Which of the following are classic symptoms of a sleep apnea? Now we know what it is. 10%, 10 seconds of apnea, but the apnea decreased blood flow is less than 50%. But what are the classic symptoms? The classic symptoms of people with sleep apnea, they have depression because all the changes that happen. They can't sleep at night. They affect them at work. They have morning headache. They become irritable. They have daytime sleepiness because they can't sleep throughout the night. I'll give you the acronym that you can remember. And they have forgetfulness. They forget things. And they have mood changes in addition to that. And they have morning headache because they can't sleep at night. They can't concentrate and they snore. So depression, daytime sleepiness, forgetfulness, mood change, morning headache, difficulty concentration, and snoring. All they stay happy to them. This is why we got to and treat this problem. They have problem with a forgetfulness and in daytime sleepiness. If they are work, most of them end up being fired, and that leads to that depression. Okay, so that's for that one. So what are the specific criteria to trigger a study for a suspected OSA? What is the actual OSA at all that we have apnea? So when people sleep, the upper airway, the pharynx, okay, the pharyngeal muscle, FA, is the PY, pharyngeal muscle, this muscle become weak, okay? When it become weak, it obstructs your upper airway or your tongue, you fall back and it obstructs you. They obstruct your upper airway. And you stop breathing. Because you stop breathing, what happens? So you stop breathing, your CO2 goes up, right? And your SATs go down. This is what wake you up. And then you go back again and you start breathing, and then your tongue fall back or the pharyngeal muscle relaxes, obstruct your airway, CO2 build up, desaturate, stop breathing, and they keep on doing throughout the night. This can happen multiple episodes. And it's the obstruction that causes the snoring because you're trying to push air through that. So in order to be able to trigger a sleep study, you have to have certain specific criteria. Basically, sleep study is what we use to study for you and see if you have a sleep apnea. So how do you know somebody needs sleep study? I call it stop bank. So when they give you a question, next generation question, and you want to figure out if this patient has a sleep apnea or the case we saw in the beginning, I could have used this stop bank. And you say S is for what? S is the snoring. T, they are tired most of the day. O, somebody saw them and stopped breathing. P, their blood pressure is high, so they have hypertension. B, they have a BMI greater than 34, so they have obesity. A, they're more than 50 years old. And their neck size is too big, and the G is the male gender, okay? That's a stop bank. Not everybody meets certain criteria. You have to meet more than 50% of this to be able to get a study done. You got to at least get more than. Not everybody have to meet this specific criteria. So for us, you have more than 50% of this, yeah, they will do the study. So we have these criteria. Snoring, yes, stop bank. Tired during the day, somebody saw you being apneic, you have hypertension, your BMI is greater than 34, your age is 50, neck size is greater than 17 centimeters, and you have male gender. These are specific criteria. You should know this stop bank. That's what we call it, stop bank. That is the diagnosis of obstructive sleep apnea. And when you meet these criteria, we'll do a sleep study to confirm the diagnosis. Don't forget this. You write it down, and then you look at the cases and say, oh, this is it. You meet all these criteria. Okay? So that's that one. So that's what is needed. What is the confirmatory test for OSA? So the test I was talking about to diagnose the OSA is not EKG, you know that. EEG is look at your brain. EMG is looking at muscle, okay, activity, nerve conduction. This is the fancy word. It's the same as sleep study. Trust me, they're not going to say sleep study because it's about sleep. They will give you this fancy name, polysomnography. Forget about it. Graphy is just taking reading, and polysomnia is sleep. So polysomnography, that's the name you will see in your test. It's some fancy word, but you've never seen it before. That is what it is, polysomnography. Polysomnography, okay? It's not EKG, it's not EEG, it's not EMG, okay? They do an EEG in addition so that they can trace your brain function, but the whole study is a polysomnography. Okay, that's the confirmatory test. What is the treatment of OSA? Patient always having apneic episode, and then they stop breathing. They wake up multiple times. So what is their problem? They wake up in the morning, they're tired, they're not being able to sleep throughout the night. Do you want them to have a stimulant at night? Stimulant will keep them awake all day, all night too. So we don't want that. Modafinil. This is another drug we use for patients who have sleep apnea. This, I'll show you another question. I'm not going to tell you what it is, but it's one of those medications because there's a question after that. You got to look at it. So this is what we use, Modafinil. There's a reason why we use it. Weight loss, yeah, they will be obese. Their neck size is too big, and their tongue will be big. That's what is obstructing them. And therefore, we should, when you lose weight, it decreases the amount of obstruction. So this is good. No alcohol. Yes, of course, it decreases your basically level of consciousness in your sleep, and it make you more sleepy, you know, and then you get into trouble. So CPAP is another machine that we use to do something. I'm not going to tell you, but it's one of the, because there's another question that I don't want to give the answer away. Take nap during the day. When you take nap during the day, what happens? At night, you don't want to sleep. Therefore, you should not take nap during the day. So modafinil, weight loss, no alcohol, and CPAP are good. Don't take stimulant during the night, and don't take nap during the day. These are the things you tell the patient not to do. Okay. Now, how does modafinil and CPAP works? How do they work? This modafinil is what we use for daytime sleepiness. Daytime sleepiness. When you're sleeping during the day, this is what we give it to you to keep you awake during the day. And what do you tell the patient? Don't take it at night, because if you take it at night, you'll be awake all night, and that will be a problem. You can't sleep. So take it during the day, and it helps with what? Daytime sleepiness. What does CPAP do? What is the problem with CPAP and sleep apnea? Their pharyngeal muscle, okay, obstruct their airway, or their tongue obstruct their airway. We want to deliver certain pressure, positive pressure, okay, inside you to keep the pharyngeal muscle from collapsing. So keep, all it does is CPAP prevent, okay, obstruction. That's all. That's all. It does not cure you from CPAP, from sleep apnea. It just deliver a positive pressure to prevent obstruction. It's not the negative pressure. And this is a test-taking strategy. You can look. One of them has to be right. There's one increasing, decreasing. There's one increasing. So that tells you there's only two answers that are maybe close to each other, and one should be the right answer. It decreases daytime sleepiness. You have to make sure the whole thing is complete. That's the modafinil. But does CPAP deliver negative pressure? No, positive pressure. Modafinil does not increase daytime sleeping. Therefore, this is wrong. It decreases daytime sleeping, right? And these deliver positive pressure. So C sound good. Look at number 4. Increase daytime sleeping. No. So that the whole answer is wrong. So modafinil decreases daytime sleepiness, and CPAP deliver positive continuous pressure. And that is what we call it, CPAP, continuous positive airway pressure. Okay, so that's the way it works. And finally, sometimes you don't see CPAP, you see BiPAP. Don't worry. CPAP is continuous positive airway pressure. What is BiPAP? It's just bi-level positive airway pressure. What is the difference? CPAP, when they put it on you, whether you're taking breath, inhalation, or exhalation, that means in or out, the machine will give you certain pressure of air, whether you like it or not. So it just blasts you, whether you're breathing or not. When you're taking in breath in and out, it just destroying you. It just giving it to you. BiPAP is more comfortable. Why? Because if you take a breath, it changes the pressure, whether you're taking breath or you're not taking breath. So during inhalation and exhalation, when you're taking a breath, it gives you different kind of pressure to regulate you. So it's more comfortable for the patient. So there is a difference. CPAP deliver same pressure during inhalation, okay. By BiPAP, same pressure, no. CPAP, same pressure during inhalation. BiPAP, different pressure for, yes. And this is 3. CPAP, different pressure during inhalation, no. So the answer choice is the CPAP, same pressure during inhalation and exhalation, and BiPAP, different pressure for inhalation and exhalation. That's how they work. You have to know the way they work, and because sometimes they may ask you in the case form. You don't know what they're going to give you. So if there's a little bit of knowledge, just put it in your pocket. This is the end of sleep apnea. This is the comprehensive review, just basically covering medication management, teaching, diagnosis, and all the things you need to know. Thank you for your time. And subscribe if you've not subscribed so that you can, and put your notification on. That is the key. If you don't put your notification on when I make a video, you will not know. Please put your notification on so that you can get more content like that. All the best of luck. Thank you very much.